I want to talk honestly about what's really like working as a doctor in Australia. There's a lot of positivity and a lot of challenges. And if you're an IMG thinking of coming over here, or you're already working here, you can relate to almost everything on the list. And if you don't, please add on more in the comment section. Let's start with the good and then we'll move on to not so good. 10 good things. Number one, EMR and technology. Australia's hospitals are incredibly digital. Notes, medications, fluids, observation, everything is paperless. Some private hospitals even use AI-powered tools like Heidi Health and transcribing tools where your notes are automatically transcribed as you speak to the patient. Most of the GPs are using these tools and improving their efficiency, seeing more patients. You literally save hours every week on documentation. Number two, approachable consultants. One of the best things for me as an emergency medicine consultant is direct communication. You can call specialist consultants anytime for admission or an advice. No rigid hierarchies, no pointless barriers. This means fast decision and less unnecessary investigation and testing. Number three, excellent communication between doctors. GPs and specialists often call ED doctors before sending in the patient. You know exactly what's coming, what's been done so far, and what the plan is. Many of these patients can even be directly admitted to the ward, saving time and avoiding crowding waiting rooms, especially here in emergency department. Strong private healthcare system. If the patient has private health cover, which most of the Australians now beginning to have, wait times for non-emergency procedures are short. Angiographies, endoscopies, surgeries, orthopedic and plastics, many are done within weeks, not months. It genuinely improves the quality of life for those who can afford it. Number five, GP and urgent care support. Australia is investing heavily in keeping patients out of the hospital, especially emergency departments. Bulk billing incentives, urgent care clinics, after-hour services. These ease the load on emergency department. And I can remember post-COVID when there was a rush of patients in emergency department. It is exactly that time these initiatives were taken. Number six, excellent salaries. Junior doctors earn about $80,000 to $140,000. GP can go up to $150,000 to $350,000. Specialists can earn up to $500,000. Most overtime work is paid. It is one of the few countries where a doctor can have comfortable life, even with a family, without financial stress, provided you know how to budget yourself. A relaxed work culture. At first, the culture may feel strange, but once you settle in, you realize Australians are generally very laid back, friendly, and easy to work with. Over time, the workspace feels more relaxed and more familiar and a lot more enjoyable. I'm beginning to enjoy my work even more now that I've spent almost 8 to 10 years working in the same hospital. The weather. Now, it might not be directly related to medicine, but trust me, it affects everything. Bright mornings, warm evenings, long daylight hours. You finish your work and you still have time for a walk, fresh air and sunlight. It helps your mental health more than you can realize. Generous leave allowances. As a full-time consultant, you get around 4 weeks of annual leave and 2 weeks of study leave, plus public holidays. Depending on how you roster your work, many consultants effectively work around 8 months of the year and take 4 months off without being part-time. It is one of the best work-life balances in healthcare. Number 10, excellent acute healthcare system. Now, this one is very close to my heart. Any emergency is properly dealt with. There are emergency retrieval services with the proper ambulance and emergency retrieval doctors, trauma care, ICU, stroke pathways, acute myocardial infarction pathways, you name it, and they have got it all planned in a very organized way. Australia's acute system is world-class. Senior doctors are involved right from the beginning, picking up the patient from the home through the ambulance if they're critically unwell. Do all the critical care procedure before bringing them to hospital and an emergency department and then moving them to ICU. As a clinician, it is satisfying to work in a system that actually functions seamlessly across all those major steps. What about 10 not so good things about working as a doctor in Australia? Number one, excessive administration. You repeat everything multiple times. ID exams, visas, working with children, APRA requirements, and 2 years later, you may have to repeat them all over again for a permanent resident visas. Paperwork fatigue is actually real. And this is one of the most heavily staunch criticism of Australian health system, which is actually delaying the IMG doctors to take up their work in the regional and rural communities where the work is mostly required. And that's what it was said in the Kruk report as well. Extremely high competition. Now, med school entry is competitive. Other specialty as postgraduate clinical training is comparative, like dermatology, pediatric surgery, plastics, cardiothoracics, you name it. Australia is a small country with tightly regulated specialty numbers. There is an oversupply of non-training registrars fighting for tiny number of accredited positions. Many spend years in service role without progression into the training numbers, and sometimes they'll give up and move into other specialties. Heavy scrutiny. Junior doctors often feel watched and corrected for everything. Some see that is a good thing. It is a good level of supervision, good level of oversight into their medical practices. Other feels being micromanaged. Sometimes it feels less like mentoring, but more like policing. Staff shortages in rural areas. If you're working regionally, you'll feel the pinch. Getting leave covered is hard. Sick leave coverage is worse. You often carry the workload of multiple people. I was recently contacted by one of the GPs who was working in a border town between South Australia and Victoria, and he was the only GP or one of the only GPs in town, and all his staff, medical staff, had left, and he was working pretty much 5 to 6 days a week, and he'd been there for a number of years, and he was desperate to find more staff and more GPs. Bullying and harassment. Unfortunately, this still exists. Around 50 to 60% of the junior doctors have reported bullying in certain hospital or college programs even. Various college specialist exams and specialist assessment have also been scrutinized, and there have been recommendations made, especially to the College of Intensive Care Medicine, College of Emergency Medicine, to improve their ways where they handle their doctors, both local and IMGs. Very long working hours. Despite good pay, the hours can be brutal. Some doctors routinely work 60 to 80 hours per week. I remember when I was working as a registrar in ICU in one of the major Sydney hospitals, there was a term in surgery where doctors were routinely expected to come at 6:30 and they would finish at 6:30. They were clocking in 12 to 13 hours every day, and most times 6 days of the week. So unrostered overtime is normal, but you do get paid for that. I think even if you're paid, the burnout is real. Mandatory rural placements. Training programs often require 1 to 2 years away from your preferred city. Now, families during this time get separated because you may have kids who are more established in the major town, regions, or cities. So the life becomes unstable. And IMG GPs still face the long 10-year moratorium, which many argue is unfair and outdated system. Complaints-driven culture. Minor issues often turn into formal complaints very easily. Are resolved quickly, but the fear of investigation hangs over many doctors. Mandated reporting issues discourage doctors from seeking mental health support. That is why many IMGs eventually choose general practice to avoid hospital politics altogether and be their own boss. Number 9, violence and abuse in the system. Nursing shortages, bed block, long wait times trigger aggression. Emergency medicine department and psychiatric units feel the physical and verbal abuse infrequently, but it is a real issue. It takes a toll on doctors and staff working in these areas. Number 10, slow career establishment. Freshly graduated specialists like surgeons or specialists belonging to a particular medical specialty like gastroenterology or cardiology, they may take time to build up their private practice. Emergency medicine consultants now are facing limited job opportunities in big cities, and they're now moving more towards the regional metropolitan areas. More doctors are now choosing to work regionally where there's a good work-life balance, first to get established their private practice and then to stay there with their families so that they can establish their life over there. Conclusion, the truth is working as a doctor in Australia comes with massive advantages but a fair amount of challenges like any other place. But the longer you stay, the more confident you become and these challenges start to ease off. Once you know the people you work with, you know the system, your judgment becomes better. Now, I've been here for about 20 years and trust me, when I came into the system fresh, it was a massive challenge dealing with the doctors, dealing with the juniors, dealing with the specialties. I had my fair share of complaints as well. But despite the fact I went through all this toll, I agree that right now my life working as an emergency medicine consultant across 2 or 3 hospitals, I have achieved my balance to be in the right place, provided you are able to establish yourself and improve yourself consistently over time. Overall, Australia is a fantastic place to work if you're willing to put in the effort. Trust me, you'll not only survive, but you'll actually thrive and you'll truly build a rewarding career here. Thank you very much. Look after yourself and each other, and I'll catch you up in the next video. Goodbye.